This is Ethan Moore. I'm going to be performing my range of motion exercises. Before we get started, it's important to remember that it's the nurse's responsibility to always support the patient's joints while they're doing the range of motion exercises and to never move them past their free range of motion so you prevent injury. And if the patient ever feels tired or in pain, to stop. First, we have the neck joint. The position that we're in right now is extension. Then we have flexion, which is chin down and chin down towards your chest. Then we have hyperextension, which is chin up and head back. We have lateral rotation, where you put your ear to your shoulder, to the right or to the left. Then we have rotation, which is looking over your shoulder to the right or to the left. Next, we move on to our shoulder. The position that we're in right now is extension. Then we have flexion and hyperextension. Then we have abduction and adduction. Abduction would be bringing the joint away from the body, and adduction would be bringing it back in. Rotation, we have, we bring our elbow to our shoulder, and we have extension, internal rotation, and external rotation. Next, we move to our elbow. We have extension and flexion. Then we have our forearm. Straight up is supination, and down is pronation. Move on to our wrist. We have extension, flexion, and hyperextension. This is abducting the wrist and adducting the wrist. To our thumb, we have flexion, which is in towards the palm, and hyperextension, which is down towards the radius. And then we have opposition, which is just touching each finger to your thumb. Next, we move on to our fingers. We have extension, and then flexion, bring them in towards your palm. And then adduction would be putting them all together. Abduction would be moving them all apart. Then we have our hip. We're in extension right now. Then we have flexion and hyperextension. Next, we rotate our hip. We have internal rotation, where you move your thigh towards the center of your body, and external rotation, where you move it away from your body. Next, we have the knee, which is flexion and extension, and then our ankle. We have dorsiflexion, which is back towards us, and plantar flexion, which is towards the ground. Inversion will be turning it in towards your body, and eversion turning it away from your body. The toes are similar to the finger in that extension is straight and flexion would be curled in.